Do we have Alex Woodley on from City of Reno? All right, we'll start here in a couple minutes. We have a special guest, and I want to make sure he's connected. All right, we'll go ahead and get started. Thank you guys for joining us for the Washoe County COVID-19 weekly media briefing. We'll have District Health Officer Kevin Dick on in a moment, and we'll have Aaron Keniston available for questions. Aaron is our incident commander of the incident management team. We have a special guest today, Alex Woodley from the City of Reno and Code Enforcement. He's the Assistant Director of Neighborhood Services. Has an important message just about kind of what, from the enforcement side, what they're seeing with large gatherings and how that impacts COVID-19. So, Alex, if you're ready, please go ahead. Oh, looks like you're muted there, Alex.
Morning.
There we go. Yep, good to go. Thank you.
Outstanding. Thank you. Yes, good morning, everyone. This is Alex Woodley with the City of Reno. What I'll do is I'll go ahead and get into it just to give you guys an idea of what we're seeing out there in the community. Unfortunately, we've been getting a lot of phone calls, specifically to our police department regarding social gatherings, and we're identifying a lot of what we identify as party houses. It appears that individuals, for lack of another venue, we've been seeing a significant increase in calls to the police department for disturbances of the peace. And typically when we go out there, what we've seen is parties having up to over 100 people in a single family residence. You can imagine this is something, there's multiple issues with this. There's over occupancy issues. There's obviously concerns with COVID spread. There's also issues with safety. We've had 2 of those parties in the last month that involved a shooting of some type. So we have a lot of concern. Unfortunately for us, unlike businesses, there is no occupancy limit that's being actually regulated as we do with businesses, because every business gets an occupancy load. There isn't any free access for law enforcement when we do go out there. So for example, we've had parties where we've approached the property, knocked on the door, and they just refused to answer. At a single family residence, we will not force entry unless there is something much more egregious than a misdemeanor offense, which in this particular situation would be a disturbance of the peace. So with that being said, we would like to get the message out to everyone that we are addressing these parties. Even if we aren't able to get access into the property, we are following up with code enforcement, and we do have the ability to issue citations to the property owners, and that is what we're doing. Unfortunately, it's a reactive approach, so we're not able to stop it before it happens. So we are getting complaints from citizens in neighborhoods, and we do recommend that if individuals do have that issue in their neighborhood, to please call us. We are working with the health department so that they can follow up, and we can compare our data to identify if these actual addresses are related to COVID spread through their contact tracing. So we're addressing it from that perspective as well, which is a significant issue for us with the property owners as well. So not only will we have the disturbance of the peace, but we'll also have a public nuisance, attractive public nuisance with the property if that's what's occurring. We do have concerns with these parties at these houses. We don't want to have a situation like in other cities. Unfortunately, we've been fortunate in Reno not to have this type of situation, but you've probably heard or seen situations where there are an excess number of people on a rear deck, on a two-story deck, and then the entire deck collapses, and then there's significant injuries and bodily harms. So that's something that we really want to avoid. So that's something that we are addressing, and we're trying different approaches, and we are addressing it with the property owners. If we're able to make contact the police officers on scene, then they will, and they'll cite the appropriate individuals, and we'll break up the party. But if we're not able to even enter the property, it makes it very difficult for us to do anything on scene at that time. So we just ask that the information gets out there, and we appreciate any help you can give us with sharing this information.
Thank you very much, Alex. Appreciate that update. If you have questions for Alex, we'll save them to the end. We'll go ahead and go to District Health Officer Kevin Dick right now. Kevin, if you're ready, please go ahead and give your update.
Yes, thank you, Scott, and thanks everybody for joining us. Alex, thank you for that update. Well, I'd like to begin with the sad news that we received this morning about Mayor Ron Smith of Sparks passing away. Ron was a person that led with dignity and compassion. He cared deeply about the city of Sparks and our community. He was a warm and caring individual. He was a valued partner of the health district. And I'd like to express our deep condolences to his family, his friends, and his loved ones on this sad day. With that, I'll transition over to COVID-19. And we had a high day of cases yesterday, 105 that were reported. We see sort of some choppiness in how the numbers come in from lab testing and results. So what we like to look at is the 7-day moving average of cases. And those are at 71 as of yesterday. So that's still a high number of COVID-19 cases that we have in the community and of transmission that's occurring. We did have a recent peak of, I believe it was about 98 on that 7-day moving average. So fortunately, we've come down from that peak somewhat, but what we've seen when we look historically at the trend of COVID-19 cases is we'll hit a new high peak and then we'll come down a little bit, and then we set a new higher plateau than we had previously. And that's really what we're observing right now. And the concern is if we continue with that and set higher plateaus, then we will have an expectation to build to a new higher peak of cases from that plateau. So I want to just make sure that everybody is aware that we continue to have high levels of community transmission of COVID-19 that are occurring in the community, so that everyone can continue to be vigilant, be aware, play your role. We need to all work together to be able to continue to make progress in reducing the spread of COVID-19 in our community. And that's wearing masks, maintaining that social distancing, avoiding unnecessary errands, contacts, et cetera, that have the potential for spreading additional disease in the community. As Alex mentioned, we are seeing increasing issues and problems occurring with private gatherings. And we know that those are settings in which we're seeing the spread of disease, not just the big party houses that Alex has described, but other gatherings where extended families are coming together that are not typically together in the same household. So sadly, we're seeing disease spread. We're seeing fatalities that result from those gatherings. And we're strongly recommending for people to limit any social gatherings. If you are going to have a gathering, I would first advise against it. But second, if you are, plan carefully for that to be able to maintain that social distancing and to limit that gathering to 10 people or less. to also limit the potential for spread that could come out of that gathering. We've been working at the health district with trying to increase the lab capabilities that we have for testing coming through our drive-through post operations. And so yesterday was the first day where we engaged with testing, sending our specimens for testing to Charles River Labs. It's a local lab, a newly developed capacity that we've been able to work with, and we intend to use that lab for a couple of days a week of our testing so that we can work with that lab's capacity to maintain the throughput for them to be able to provide us with good turnaround times. And also to help to try to alleviate the bottleneck that sometimes occurs at the state lab when they are inundated with testing coming to them from counties throughout the state. So we're continuing to work and make progress, and appreciate the efforts of Charles River's lab in developing that capacity and working with the health district for us to be able to utilize it. We're also continuing to work with UNR and the Nevada Public Health Training Center for staffing, and continue to bring additional disease investigators on board to work with the follow-up on the positive cases to identify close contacts. We're utilizing the contact tracers that the state has made available through their contract with Deloitte to then follow up with those contacts to notify them. We have, I think everybody seen the impacts of the Loyalton fire and wildfire smoke in our area. So I would remind everybody to stay tuned to the air quality index that we put out. For that, we do notify the community when our air quality deteriorates to unhealthy for sensitive groups or unhealthy. So that people can take appropriate actions to protect themselves, try to avoid being outdoors in that smoke because of the potential health impacts that can have on individuals. So I think that's concludes the points I wanted to make, and I'll open it up for questioning for Alex or myself.
Thank you, Kevin. Yeah, and if you have any questions that you can't say over the microphone, if it's not working, feel free to just leave it in the chat box and I'll address that one. Go ahead.
Hi, Alex. This is Siobhan from the RGJ. You said 2 big party houses in the last month. How many party houses would you say have been over the last few months? And then what are is it a range of ages, these party houses?
Yes. Hi, this is Alex. So it is a significant range of ages, anywhere from college age to older adults. And we've had since March over 60 calls. Now, mind you, these are calls that actually came in to the police department. So there's a good chance that there's a significant number of parties that are occurring and that we don't hear about. And the last 2 within a month, we did have 2 within a month that were pretty significant, and they're being investigated right now.
This is Carson with News 4. A question for Kevin, and how this Loyalton, the wildfire, and the smoke, how does that really affect COVID symptoms? Is there an overlap there, or what can you tell us about that?
Yeah, thank you, Carson, for that question. There definitely is a connection, and we know that exposure to wildfire smoke irritates the lungs. It can have health impacts directly because of the small size of those soot particles, the PM 2.5 that we call it, that can go right through your lungs and into your bloodstream. But that irritation in the lungs as well also makes them susceptible to other infections. So if people are having that irritation, inflammation occurring from the wildfire smokes, that does make them more susceptible to the COVID-19 infection. And in addition, if people are already infected with COVID-19 and are suffering from that, then that wildfire can also exacerbate that COVID-19 and the severity of that illness that they have. So having the wildfire smoke and the COVID-19 epidemic that we're having at the same time is certainly not something that's good for our community.
Hey, this is Valentina with KTVN. We want to know how Renown is going to use the money they got from FEMA, $3 million. Do you know how that money is going to be used?
I'm sorry, I think you'll have to follow up with Renown on their plans for that funds. Those funds, I haven't been briefed on what their plans are.
Thank you.
Hey, Kevin, this is Carson with News 4 again. With the positive cases at the schools last week, I think it was 4 or 5 schools that had positive cases. Just how concerning is that before we even really got with students into those schools?
Well, it's concerning, but not surprising. This is why we had recommended that with the level of disease transmission that we have in the community, that they not open right away. So we know that we have the disease out there. Obviously the school employees are not immune, and we would expect that some of them would be the people that are infected as well, and that's what we saw last week. So we are concerned with the school reopening, because of course that creates more people being together. The school has worked hard and developed plans to try to address those risks and try to reduce the potential for spread of the disease. But I think it's inevitable that we'll see that occurring. We have dedicated individuals on our teams for the disease investigation to be able to identify the pediatric cases that are coming in as positives for COVID-19, to be able to try to address those immediately, to take action and identify if they're in the schools, if they're distance learning, and do the appropriate investigation to exclude other people as necessary.
Hey, Kevin, Kenzie with News 4, kind of piggybacking off of that question. UNR is set to go back on Monday. What kind of working relationship do you have with them? I mean, we're seeing colleges across the country shut down 8 days after reopening because such high spread.
We're working closely with UNR as well. They have student health services engaged, and a much broader group across the university and the campus in how they've planned for this. But we've been in close contact with our epidemiology team, and we'll continue to work with them as well as we go through their reopening.
Are you concerned about them reopening?
Of course I am. I'm concerned about all of the things that are open and where people are interacting, because we know that's what leads to the spread. Is if you have a person that's infected that's coming into contact with a person that's not infected, that virus wants to try to infect that other host so that the virus can replicate in their body. That's why it's so important that everybody understand and play their role in working together to take those preventive measures to prevent the spread of the disease when we do have people that are in contact with one another.
And then one more question. It's the order about bars reopening can expire as soon as tomorrow. What if Washoe County decides to open bars? Is that a good idea?
Well, it's something that we've been discussing, and we feel like it may be actually a better course of action for Washoe County than having the bars closed and not having that opportunity for people to get together to socialize in a regulated and controlled environment. So Alex talked about the issues that are occurring with private gatherings and party houses, et cetera. I think the party houses are a large scale, but I think there are probably numerous instances that are occurring in our community where if people can't get together at a bar, they're going over to somebody's house to have a few drinks and to socialize there. So we are actually proposing to the state task force, and we'll be discussing that with them tomorrow, if we have strict regulations on how bars would operate to be able to maintain social distancing and work to prevent the spread, whether that would be advantageous to have that socializing occurring in that regulated environment versus not having the bars available and people getting together without any controls on their interactions.
So just to follow up on that, this is Siobhan. So you have a proposal to open the bars, but with really strict regulations. That's what you'll discuss tomorrow?
That's the approach from the region, working together with Washoe County and the cities of Reno and Sparks, and that will be up for consideration tomorrow with the state's task force.
Hi, Kevin. This is.
Oh, go ahead.
Sorry, Siobhan. Do you want to go now?
But it was just a follow up to that. Is there any stricter regulation than what we've seen already with bars? I'm assuming it would be masks and like people being spaced apart. Is there some other thing you would recommend?
Yeah, it includes those basic. It includes a safety plan that the bar would have to prepare that would be posted for their employees and for guests. It would include provisions for additional cleaning of surfaces and restrooms. So I think that's kind of the gist of it, but putting a number of measures in place that we think would be important for the bars to have and would enhance the safety of being able, or the ability of them to be able to reopen safely.
Hi, Kevin. This is Shaditi from This is Reno. My question is, if there's an outbreak in the schools, do they have a guideline provided by state or county as to how they should respond? That's my first question. And my second question is, if there is increased provision for tests at UNR or at the schools?
So the first question, as far as a plan for what to do if there's an outbreak at the schools, we work closely with the schools to develop an outbreak response plan, and I believe that's posted on their website. I believe the latest revision on that was as of July 31st, and so that provides the information of the outline of how we will approach outbreaks that occur in the schools. As far as testing with the schools and UNR, we have not made any special arrangements with them. I believe that they may have been looking into some themselves, but we currently do have capacity for the drive-through testing at our post. And so that's operating now 5 days per week. We've actually seen a decline in the number of people that have been requesting and getting scheduled to be tested through the post. So we do have additional capacity available there if people want to be tested through the drive-through process.
Okay, thank you.
Kevin, Dick, Siobhan again. Did you recommend to UNR that they not do in-person learning?
We did not have a request from them for any recommendation, but we've been working with them on their plans moving forward.
Would you have recommended that they not do in person?
I believe that would have been the same recommendation that I would have made based on the level of disease transmission that we have occurring in the county.
Hey, it's Valentina with KTVN again. Does the county have a plan for vaccination, or is that something that you're not crafting yet?
We do have plans for vaccination, and there's 2 different vaccinations that we're planning for. More immediately, we have flu season coming up. And so we are planning on doing drive-through pods, points of dispensing, to be able to provide allow people to get vaccinated for influenza beginning in September. And then longer term, we're also developing plans for how we will provide vaccinations, but also working with community partners, both for the influenza vaccination and for a COVID-19 vaccination when that's available.
And how would that COVID-19 vaccination look like?
Well, there still have trials going on, and we don't have a vaccine yet. But it looks likely that the vaccine will probably be one that requires 2 doses, the initial dose and then a booster within about a month or so. So that's kind of what we're anticipating at this point. Obviously, one shot would be a lot easier for us to do, so it's going to be a little complicated with the 2 doses. And it'll be an additional challenge to try to ensure that people that come through for that first dose actually get back and get that second booster within the time frame that's going to be required.
But any plans for who would get it first, or?
We have some different scenarios for the priority populations for who would be getting it first, but those are still being developed.
Shaditi again.
Kevin, Siobhan again. Do you have jurisdiction to tell UNR, like you do with the school district, to do something if they were to have a big outbreak?
NRS does not specifically provide that authority for the direction in responding to epidemics under statute that we have with public and private schools. However, we have a close relationship and have worked historically with UNR on outbreaks very closely together in that regard, and I anticipate that will be our continuing relationship as we move forward through this one.
Do you have some sort of metrics at a level that, you know, might affect a dorm or something like that? Do you have metrics in mind like you kind of have with the school district? Do you have some sort of system for higher ed?
A dorm room is a dorm complex is a lot different than a classroom. And I think what we'll be doing is working together if they have a positive case to be able to identify what individuals, if any, were close contacts of that case that would need to be quarantined.
It must be hard with UNR getting so many people from other places coming to town. I mean, the school district, you've been clear on your feelings on that being so scary, but with UNR, people coming from California and Las Vegas and all over the world, you know, that must be just another, we haven't talked a lot about higher ed, but that's got to be just a overwhelming thought.
Well, it's a challenge that many communities and universities are facing across the country.
Hi, Kevin. Shaditi again. So kind of going off of the vaccine conversation, so there are information all over the internet that says that flu vaccine can help fighting with COVID-19. That's incorrect, but what do you tell Nevadans who believe that flu vaccine might have some sort of benefit?
Well, I think the flu vaccine will have an immediate benefit of people not getting the flu or getting the flu less severely if they get that vaccine. So I would encourage everybody to get the flu vaccine unless there is a medical reason for them not to. The flu has the similar symptoms to COVID-19, and so to the extent that we can prevent people from getting the flu, that will also avoid a concern about whether those people have COVID-19 or not when they may have the flu. Additionally, while the flu is not as lethal as COVID-19, it still is, and we lose tens of thousands of people to flu. So if to the extent that we can have people participating in getting that vaccination and not getting the flu or getting a less severe case of the flu, that also helps to protect our healthcare system if those people are not otherwise hospitalized with complications from the flu. There have been some studies or some suggestions anyway that people that are active in getting immunizations may have less severe cases of COVID-19 because of the stimulus for the immune system that those immunizations provide. And so that's another reason for people to keep up on all of their immunizations, including getting that annual flu vaccine.
So just to be absolutely clear, so getting a flu vaccine would maybe indirectly prevent people getting COVID-19?
Maybe not prevent, but there are some evidence suggesting that if people are active in staying up to date and getting all their immunizations, their immune system may be able to better respond to COVID-19 and have a less severe case.
Will you do any push with the school district on the flu vaccine for children? I mean, just looking at some of the stats on how few school-age children get the flu vaccine, that must be alarming because we're going to be shutting down classrooms if people show symptoms. I would think that would be a big push for everybody.
We haven't had any specific plans that I'm aware of with the schools at this point. For that, most recently, we've been really pushing on all the immunizations that the kids need to get back to school.
Could the state ever, and I had this conversation with just a epidemiologist at UNR, could the state ever add into the vaccine requirement the COVID vaccine? You know, is that something you think lawmakers should be talking about at the next session?
I haven't really had the time to even think about that, so I think I'll not respond to that at this point.
And then another one for Alex. This is Siobhan again. Just you said you're investigating those two big parties. What's that? What do you mean? You go find out who had the house, who owns the house, and then you're going to talk to them about, are you going to do this party again, or?
That is correct. Our depending on the severity of the party, if it's necessary, we'll make a face-to-face contact, and that's occurring today with one of the properties. Typically, what we do is we send a notice to the owner, providing them an opportunity to inform us how they plan on mitigating this so that it doesn't happen again. And then if it does happen again, we do issue citations. Depending on how big the issue is, since this one was a pretty significant party and we had twice at the same location, we do have police officers and code enforcement officers making contact this morning.
Oh, so that was a party, the two in the last month was the same house?
That is correct, yes.
And what was the age group of that? Is that college kids, older people?
At this point, I don't have the specifics yet. I need to look at the police reports.
So it was 2 in July or 2 just within the last 4 weeks?
I would say 2 within the last 3 weeks.
Okay. And then Kevin, you talked about some of these smaller parties or people gatherings, people then resulting in death. Do you have any case where like graduation party, or is there any kind of case that really stands out without giving away details, but was it like a Mother's Day brunch and someone died, or do you have something where just with a little bit of detail, because I think people like to hear?
Yeah, I had mentioned previously, and there are probably other cases like this, but there was a 4th of July gathering that a family had, and so they had extended family that were coming from out of state, California, and getting together for a 4th of July celebration. And we had, I believe it was 9 cases that came out of that, and sadly one of those individuals passed away.
Thanks.
All right, any other questions for Alex Woodley or Kevin Dick or Aaron Kinniston? All right. I'd like to show you guys one thing if you have a second. We made some additions to our dashboard, the COVID-19 dashboard. We included testing locations in Northern Nevada. So it's a little tab at the bottom. You can see all kinds of different places that are offering testing in addition to the Washoe County Health District. We also have a governor's criteria tab that has the 3 criteria for the governor's elevated disease transmission threshold. The first one is the cases per 100,000 over the last 30 days. So that's updated on a daily basis. And there's the line where it needs to be under. The other 2 are positivity rate and the number of tests per 100,000 population. We're working with the state to try and get that data API'd straight to our dashboard. I don't have an update on when that'll be, but we're hopeful that we can get that done soon. In the meantime, there's the numbers that are here right now, the 7.8% and the 206.7 are based on the weekly updates that are provided every Friday. So this goes back to August 13th. So we hope to have, I'll let you guys know when we have that information hopefully updated on a daily basis. Other than that, thank you guys very much for attending. If you have any questions, feel free to reach out. And thanks again to our guest, Alex Woodley, who's always well dressed. We appreciate you for being on here. All right. Thank you, guys.
Thank you.